So I'm Dr. George Grossberg. I'm the Samuel W. Fordyce Professor of Psychiatry and head of Geriatric Psychiatry at St. Louis University School of Medicine. So I'm going to take this opportunity to kind of share with you what I've called some take-home points on the presentations that I'm doing at the annual American Academy of Clinical Psychiatry meeting, which is taking place here in Chicago. Excellent meeting. I encourage you all to come next year if you weren't able to make it this year. So I was asked to talk about two topics that I think are very, very important for clinicians, particularly those that see older adults with a variety of mental disorders. To speak about changes and disturbances in sleep in older adults in general, and then to focus more specifically on the impact of sleep disturbances and sleep problems in individuals with dementias like Alzheimer's disease. So the take-home points. The first topical area, thinking about older adults and sleep, and one take-home point is ubiquitous problems with sleep in older adults. So you're going to see older adults who almost always have sleep disturbances of one type or another. So it's very, very important to ask about sleep. Ask detailed questions about sleep. If there's a bed partner, a spouse, or whomever, bring that person in to get more details about sleep, because not only are these problems extremely common, but they can also be a significant source of disability for the older adult as well as their significant other or their caregiver, and may even result in cognitive changes. So we know that poor quality or decreased quantity of high quality sleep in someone that's an older adult can actually mimic Alzheimer's disease. So it's very, very important that we ask about quality of sleep, nature of sleep, and look for the most common sleep disturbances. Take-home point number two, once you get this detailed sleep history, what are the most common disturbances? By far and away most important, sleep apnea, obstructive sleep apnea. The person with the heavy snoring, interrupted at night by periods of kind of very eerie quietness, treatable often with CPAP, with continuous positive airway pressure breathing. Second most common, restless leg syndrome. Again, treatable, variety of medications, important to ask about movement during sleep. And then of course we have things like general insomnia, which often has a high association with things like depression. The second presentation focuses more on sleep disorders in the context of dementia. And this area is, again, very, very important. You have a patient with a pre-existing diagnosis of Alzheimer's disease or related disorders. I think one major take-home point is assume, again, that they're going to have sleep problems, that the dementing process fragments the sleep even more than aging already does. And the less sleep and the less quality sleep that they get, the more likely it is that you're going to be encountering behavioral disturbances. For example, sundowning, huge problem in dementia patients. There may be some practical approaches to dealing with that, may relate to circadian rhythm disturbances, a very important area in dementia. Bottom line again, assume that these are problems, ask clear questions, identify specific syndromes, because if you do, treatment is available, and with treatment we can improve quality of life for the Alzheimer's patient, the dementia patient, as well as their caregiver, whether at home or in the long-term care environment, and good treatment is available. Thank you very much.